Welcome. Nice to see everyone. Thank you for joining us for our traditional live Q&A session that is dedicated to our very dear topic to me, which is the irritable bowel syndrome. And the purpose of this meeting and this video is to show you the difference between approach that functional medicine offers to the people who suffer from irritable bowel syndrome compared to the conventional medicine approach. So with that, I will share my slides. So this is a just educational webinar for people who are not familiar with functional medicine. I see a lot of you who are present on today's call are very well familiar with the functional medicine approach because you are either my clients or you're considering to become a client, and you've been speaking with my staff already to learn how we provide this very detailed oriented care for our patients. So let's jump into their new perspectives on irritable bowel disease. And so today we're going to discuss what is irritable bowel syndrome, or IBS. What are the symptoms that people may experience, and what are the common causes and the treatment options that functional medicine approach offers to patients with IBS. And also we'll touch upon their special program that we offer in our office that is called GI Health Program, the pillars of GI Health. So what is their IBS, or irritable bowel syndrome? So as you probably know, it's intestinal disorders that defined as their collection of variety of the symptoms. And there's no two people with IBS who look alike, but there is some similarity and there's some overlap of symptoms. Some people will present with pains in the stomach or in their abdomen, either in their upper abdomen or in the lower abdomen. Gas and bloating is probably one of the most common symptoms for IBS. Could this be associated with cramping? And here's the difference. Some people will present with a diarrhea, which could be very unpredictable. And some people will present with just severe constipation when they have to constantly think about laxative. And some people will present with both, or alteration of their diarrhea and constipation. So the symptoms are varied. So, and these symptoms can occur very frequently, and they can interchange, and they usually occur for more than 6 months. And then at that point, people will come to their gastroenterologist or to their primary care doctor, and they would say, I have bloating. And they will run the test, and the test will be usually normal. But however, we now know that 70% of the patients with IBS have undiagnosed SIBO. So what is SIBO? SIBO is the small intestinal bacterial overgrowth. It could be a serious condition, very uncomfortable for some people, and becomes really, really persistent. And that's the condition, obviously, based on the name, you understand it affects the small intestine. It occurs when the bacteria that are normally present in the large intestine slowly migrate it's a bacteria from large intestine migrate to the small intestine in the large quantities. And they find home in the small intestine, and they start eating undigested food in the small intestine and produce a lot of gas. And the gas can be either hydrogen gas or methane gas. And we now know that there might be some other gases present. But the symptoms of their SIBO are very similar to IBS. So it's kind of a subdivision of the IBS. Since I've been in functional medicine, I knew that IBS is just a garbage diagnosis. When you can't find anything with the patients with conventional testing, they do colonoscopy, they do endoscopy, and nothing seems to be abnormal. Well, we're going to put these patients to this IBS, or irritable bowel syndrome basket, because we just don't know what's going on with these people. And again, SIBO can present with the same symptoms like IBS: abdominal pain, bloating, constipation, sometimes diarrhea. And so this is what happens in IBS and in SIBO. On the left, you can see that this is the normal gastrointestinal tract. The bacteria is in the stomach and progressing into the small intestine. In the stomach, it's actually the minimum amount of bacteria. As we go down to the small intestine, the number of the bacteria is growing. And of course, the largest amount of the bacteria, 10 and 12 degree, is definitely the largest quantity of the bacteria. So what happened with the SIBO, that bacteria from their large intestine slowly but surely start migrating upwards to the small intestine. And they find a paradise of food there because the food in the small intestine is still partially digested. And therefore, there's tons of their nutrients for the bacteria to multiply and generate the gas. And that's what happens with the SIBO. As you can see, their small intestine becomes inflamed, they become dilated or enlarged, and that's what gives people a lot of symptoms of bloating, pain, gas, and discomfort. So what are the common causes of SIBO as well as IBS? Anything that contributes to low motility. Motility is their movement of their food through the gastrointestinal tract. That's just a fancy word of that movement of their bolus of their food traveling from stomach, where it's partially digested, into small intestine, where it's digested more under the effect of their digestive juices, right? Pancreatic juice, bile, and then as it's being digested and assimilated, it's supposed to move into the large intestine, where their assimilation continues and the largest amount of fluid is supposed to be absorbed into the body. So what can cause this low motility? Of course, their low thyroid function. That's why in every patient with IBS, and especially with slow motility, we need to check thyroid function, as well as with their fast motility. So people with diarrhea can have a hyperthyroid. So this is very important to do a detailed thyroid exam and the testing. It could be different blockages in the digestive tract, either due to their adhesions, due to the previous surgeries, or some benign or other tumors that need to be ruled out. Prolonged use of specific medications like opioids that slow down the motility of the gut can also cause the IBS and swelling and SIBO. Diabetes is another condition that will slow down the motility of your gastrointestinal tract, but also nervous system imbalances. For example, imbalance of sympathetic and parasympathetic nervous system, the autonomic nervous system that is running our body and running our digestion. When we are stressed and nervous, we cannot digest the food, right? We need to be in a relaxed state. So that's why it's so important when we eat to really create the environment where you can process the food, chew it properly, swallow, and not just be on a rush and run in front of your screen and engulfing the food, inhaling the food, as I call it. So that's very, very important to relax our nervous system, prepare the juices, prepare our digestive tract with their digestive juices to accept the food and break down the food and assimilate it. But also general inflammation that will translate into the inflammation of the brain. Because if we inflame systemically, our brain will be inflamed as well. And that will translate into the vagus nerve dysfunction, which is commonly involved in SIBO and IBS. So all of those factors we need to look at before we determine what is the root cause of IBS. So if some of you had an experience with conventional or traditional medicine, you'll know that if people experience diarrhea or IBS-D or diarrheal IBS, they might be prescribed some anti-diarrheal medication or antibiotics. Now more and more gastroenterologists aware of a SIBO as an underlying cause of their IBS. So they will prescribe some antibiotics, either one course or second course, or even sometimes third course. So what we see, patients will feel better temporarily, but then once the antibiotics wear off, that slow growth of their intestinal flora in the small intestine will become an issue again. So they end up exactly where they were. Why? Because their underlying cause was not resolved. So for people with IBS, traditionally, conventional doctors can prescribe the variety of the laxatives. And there's books written about the number of variety of the laxatives that are out there, either over the counter or prescriptives. But with functional medicine approach, we work very, very differently. First of all, the food is the medicine, functional medicine. So we are paying a lot of attention to this intervention because think about it. We eat at least 2 or 3 times a day. Some people are more often than others. So every time you eat something, you send a message to your intestines, to your flora, to your body about what does this mean for you? Is that supportive food, or is it an opposite? Is it a damaging food for you? So diet is a really #1 intervention in functional medicine, and we pay a lot of attention to it. And then we do a very specific tests. We do sometimes conventional blood test, but we also like to look at their food sensitivity blood test that we offer in our office. We do a very specific stool test that looks not only at the microbiome, pathological microbiome, but also normal microbiome, and their commensal flora and opportunistic flora that should be there, but should not be overgrown over certain limits, because if it is overgrown, it can be a contributing factor to SIBO and IBS. We also do breath test, which is the test to detect the amount of their gases that are commonly associated with SIBO, either hydrogen or methane. And then as a result of it, we usually treat the infections of the gut. Infections or microbial component of SIBO or IBS is always there, but we need to really figure out what is there that needs to be treated and what needs to be enhanced. We make sure that we supporting proper digestion, and we reestablish the normal motility by regulating when people eat, what they eat, how they eat, and sometimes prescribing motility agents. And we do like to restore healthy gut lining, because leaky gut or increased intestinal permeability often part of their trigger or even root cause of their SIBO. So we're doing it by utilizing this 5R approach. R stands for remove, replace, reestablish, repair, and rebalance. So when we talking about removal, we're talking about removing the eliminating triggers and improve detoxification of the gastrointestinal tract and the liver. So we're replacing and restore digestive function with the proper amount of stomach acid, digestive enzymes, and we reestablish the proper microbiome by killing and removing bad bugs and colonizing the good bugs in the right place, not necessarily in the small intestine, but maybe in the colon. We also repair by focusing on the gut lining and reducing the leaky gut. And finally, we rebalance. We like to connect the gut and the brain for proper nervous system messaging. Remember that vagal nerve is really, really important to restore the proper function, so SIBO does not reoccur. So you have to go through all of those steps and ensure that everything is in order for us to conquer IBS and teach our clients and patients what would be their important factor from those 5R. Sometimes we need to repeat it several times until patients learn how to live their life in this very special way, so the IBS doesn't reoccur and doesn't disrupt their life. So in the typical patient that I see in my practice, I see a lot of patients who come because they suffer from this bloating. And no matter what they eat, either they eat healthy or not healthy, they still experiencing the same symptoms. And even those adventurous patients who start to take in probiotics may worsen their condition. Why? Because you just saw that if you take improper probiotic for SIBO, you will enhance the microbiome of the small intestine, when in fact you need to reduce the microbial burden in the small intestine and enhance it in the large intestine. So this is like a typical person who would come with their bloating, and they will go to their primary care provider, and primary care will run several tests. Probably they will come back normal, so they'll send them to the gastroenterologist, who will scope them from the bottom and from the top, and surely will give them the IBS diagnosis. And say, well, you have to learn with it, okay? Or they will give them the medication. And patients usually don't want to take medication. Maybe they'll take it for a week or two, and then they realize that it's not really resolving the root cause. And that's how they usually come across the functional medicine or the root cause medicine, and looking for what is this specific patient's trigger. And so we'll do the testing that I mentioned, either stool test or breath test or blood test for the food sensitivities and other issues. And we'll prescribe their treatment according to that 5R program. Sometimes we do prescribe probiotics, but they're not going to be your typical probiotics. They're going to be probably very specific probiotics that are indicated in the case of SIBO. We like to prescribe some prokinetics. There's natural substances like ginger or artichoke leaves that will increase the motility in cases when the motility is slow. We inevitably will prescribe some antimicrobial herbs. Do we prescribe antibiotics? Sometimes, but I don't like to repeat antibiotics over and over. Sometimes if people need to get a fast relief, I will prescribe antibiotics, but I will educate patients that the problem is not just that microbial overgrowth. The problem might be either in the motility or your lifestyle changes that are required to resolve that issue. And that all of that needs to be addressed. So the root causes of the symptoms are resolved, and the gut health is maintained for the long term. And that's our goal. So what is the pillars of the GI health program that we implement in our practice? We would take this very detailed intake, history, and timeline. It takes about 90 minutes, and in many cases much longer, to really get the whole history and understand patients' possible triggers. We'll order the tests that I mentioned before, blood test, stool test, and then we're going to start intervention. We're going to prescribe some supplements and lifestyle intervention, where my health coaches will help to implement those intervention in the next time period. The patients will receive some homework to do. They will be learning about a specific type of the diet and specific lifestyle changes that are important to resolve the issues. And then we'll meet patients for the follow-up and discuss the testing. And also our patients are offered to join the monthly group coaching sessions as well. So if you find it's useful, and if you are suffering from this kind of conditions that we described, or you just want to get more information about my practice and how I treat patients, feel free to call our office for their additional discovery call, or subscribe to our newsletter. And you can follow me on social media. We do that. And before we jump on their questions and answers, this is their bundle that we offer for the patients who are suffering from IBS and SIBO, more IBS than SIBO in this case, that will help many of the clients to resolve their issues. And this is the product that I'm using in the practice a lot, and it helps a lot of patients to resolve the issues. And don't forget to use the code IBS bundle 15, and for the first time orders, and IBS 10 for those clients who are coming back. So you can go to our shop at their shop.drelenaklamenko.com to get this products. So I will post the questionnaire, GI questionnaire. So fill it out and send it back to us if you want to know if your gut health is in the proper level or not. And just to remind for many of you that we are running health coaching support circle for our patients and for people who just want to experience group health coaching. You can get this information from our office. We also offer a group coaching now for genetic testing, which is a 3x4 support group. You can also acquire about this information from our office or just email us. And we pay a lot of attention to educate our patients on how to relieve the stress, how to raise the resilience, how to sustain the stress of modern life when we are bombarded from all different angles with their stressors. Either it's a psychological, emotional stress, or stress of the environmental pollution. So how to build that mental and emotional resilience? Please join us for our Heart Math series class that will take place on June 7th. That's our next group. And I want to introduce also a very effective and interesting treatment modality that is based on their pulse electromagnetic field therapy. It's called On-Demand, which is their targeted evaluation of the patient's condition and organs and biological system and treatment at the same time. So it's a great method that helps us to treat some complex chronic medical cases. So when can it be helpful? It can definitely be helpful for toxin release, to improve the absorption of the nutrients, reduce the inflammation in the body, increase cellular repair and regeneration, improve circulation of the body, and great for reducing pain, addressing microorganisms, improves vitality, even improves the mood and mental clarity. And please join us for the next live Q&A, which will take place in June. And we are still open for more patients. So if you're interested, please send your friends to us, especially if you got some relief from your symptoms.